Thank you, Mr. Chairman. A lot of the debate has centered around this so-called public plan or not-for-profit plan. The proponents of a not-for-profit say that it is advanced to drive competition, to improve quality, to contain and lower costs. The opponents of change, the defenders of the status quo, say that a not-for-profit will put private plans at a competitive disadvantage. It will lead to a single-payer system. It will be like Canada. It will be a European style. It will be a massive federal government takeover of health care. These are scare tactics that are designed to confuse people to a point where they say, well, the system may not be perfect now, but we can't risk changing things. What I want to talk about is America. In America today, there are 298 million people. 153 million have employer-sponsored coverage. 15 million people have individual coverage. 81 million in Medicare and Medicaid, and 46.7 million don't have insurance. 9 million of them are kids. In America, we pay $2.5 trillion a year for health care, 20% of the American economy. These costs are expected to grow by 6.7% annually, or up to 8%. We have a potential liability of another $1 trillion to try to cover those without insurance. So as we focus on this public and private plan, if you look at all the studies that have been done, the Dartmouth study, contemporary and historical studies on the problems with the healthcare system in America, the Atul Gawande study in the New Yorker, it always cites the places that do it well. They cite specifically the Cleveland Clinic. They cite the Mayo Clinic. And guess what? Those places are delivering highest quality, low-cost care. And they just happen to be not-for-profit. The doctors aren't tenured. They're salaried. They have one-year contracts. There is peer review. Doctors are doing what doctors are supposed to do and not dealing with insurance companies. You know, cardiologists, the national average salary for a cardiologist is $370,000 a year. At the Cleveland Clinic, the average is $336,000 a year. An oncologist, national average, is $270,000 a year. At the Cleveland Clinic, it's $254,000 a year. There's a more generous compensation package for those at the Cleveland Clinic, including covering their malpractice insurance premiums. The point here is, if we're going to do a not-for-profit plan, it should be designed to do one thing. It should be a countervailing force for a system that everybody agrees is unaffordable, unsustainable, and unacceptable. Let's look at what works. Now, I know from information I got this morning that the president CEO of the Cleveland Clinic is here in Washington. Problem is, he's not here before this panel. And that's who we should be looking to for information about how to structure the fundamental piece of health care reform, and that's a not-for-profit. Not for unfair competition, but for fair competition in an American system where we pay more per capita than anybody else in the world. And our outcomes, our health care outcomes, are unacceptable and getting worse. That's all I have, Mr. Chairman. Thank you.